Hi there, welcome to our number 5 of 5 sessions of Natural Medicine House Calls from the Institute of Natural Medicine. Welcome back, those of you who have been with us all along, and welcome to those who are just jumping in. Know that you can access the series on the INM website and go back and review any that you may have missed. Today we are in for a real treat. We're talking about some hands-on approaches that can be used by naturopathic doctors and can be used in your own home. And we have two wonderful, experienced, delightful subject matter experts who are going to be joining us on this call today. I'd like to introduce my co-host here, Dr. Bev Yates from San Francisco, to introduce our first subject matter expert.
Absolutely. Thank you so much, Dr. Rothenberg. This has been a wonderful series. We continue on today to talking about the things that people can benefit from that are part of what's known as the vitalistic tradition of naturopathic medicine. It's my pleasure to introduce Dr. Letitia Dick Cronenberg, naturopathic physician with a wonderful family history as well of contributions to this medicine. Dr. Letitia Dick Cronenberg, known as Dr. Tish to many, is a second-generation practitioner of naturopathic medicine. She carries on the tradition of Dr. Otis G. Carroll, Sanopractor, and her father, Dr. Harold Dick, a naturopathic doctor, medical doctor, and chiropractor. Dr. Tish graduated from the National College of Naturopathic Medicine in 1990 and was adjunct faculty at Bastyr University for 25 years. She co-founded the Carroll Institute of Natural Healing with Dr. Jared Zeff and continues postdoctoral training there, as well as with the Naturopathic Medicine Institute to ensure the continuation of vitalistic naturopathic philosophy and medical practice. Dr. Tish practices in Washington State. And with that, we welcome Dr. Letitia Dick Cronenberg to today's webinar.
Wow, wonderful introduction, Beverly. I really greatly appreciate that, and I appreciate the opportunity to be able to share with you today some real hands-on home therapies that you can do for your children and yourself. And the nature of this is hydrotherapy, right? Hydro meaning water. So I'm going to go through some basics of how you can use water therapy at home. And just a sec, we're having a hard time transferring to the next page. There we go. And a little history on hydrotherapy in licensed naturopathic physician tradition. One of our predecessors was Dr. Otis G. Carroll, or O.G. Carroll. Dr. Carroll was famous for treating tuberculosis and MS patients in Spokane, Washington. And he was my father's mentor. And Dr. Carroll started in about the 1920s. And these traditions have been brought through our naturopathic medical schools through his lineage. So what I'm going to be teaching you is written in my textbook that I use to teach hydrotherapy at our medical schools. And excerpts from this textbook are available for you in printed version, I believe. We've got that. It's also on this PowerPoint. And you can use these anytime to treat your family at home. When we talk about constitutional hydrotherapy, Dr. Carroll called it that because you treat the very constitution of each cell. And with it, we're doing what's called a heating compress. So let me explain as we do the go through. What's the purpose of hot and what's the purpose of cold in hydrotherapy? So we're going to be applying hot and cold contrast, not just hot and not just cold. We're going to contrast them. And so the purpose of a hot application is to actually bring the blood to the surface of the skin. It makes the skin nice and pink. It causes the pores to open. And if you leave hot on longer than about 5 minutes, it causes the blood to kind of stagnate. You have what's called vasostasis. It just kind of sits there. And if you don't alternate it with cold, you kind of get that congestion. So that's why we alternate it with cold. So then what is that? What is the purpose of cold? So first you put on hot, then you apply the cold. And what the cold is going to do, it's a little bit of a shock for a minute, but it warms up quickly. What that does is it drives the blood deep into the internal organs. And as you allow that cold to warm up to body temperature, you're actually increasing a fluxing of the blood through the tissues. You get more oxygen in the system. You actually stimulate white blood cell movement through the tissues too. And so one of the purposes of doing a hot and cold contrast and then letting the cold warm back up to body temperature is what we call a heating compress. And that is specific to licensed naturopathic medicine. And I'm going to go through a couple real simple therapies that you can do at home. I'll show you how to set these up for you and your family. Go ahead to the next slide there. I think I talked about this, increasing enzyme activity, increasing white blood cells. We know after one therapy, there's 10,000 more white blood cells in circulation than before. There is no other therapy that stimulates the immune system as fast as hydrotherapy does. So it's amazing and so simple to do. So let's step you through a therapy here. There's a couple rules with this kind of therapy. You always want to cover the wet compress with wool. I have a wool blanket here. You might have a wool sweater at home that might work. If you don't have wool, you might have a Volux, and this is a rubberized fuzzy material. The purpose of the wool is to keep the body heat in as you warm up the cold towel, or if you have a hot compress on, to keep the heat in. So the neat thing about this is it also wicks the water, so this doesn't get damp or it doesn't get bogged down with the water. So that's why you want to use a wool or this rubber fuzzy stuff called Volux. Polar fleece really doesn't work well. Polar fleece will hold on to the water, and it doesn't really insulate the way you ideally. It's okay to use, but it's really not the best thing. So try to find a piece of wool, a wool sweater, something maybe an old wool scarf will work too. So the other rule of this kind of water therapy is always end with a cold. Now you don't want to, it's always not the most comfortable thing to end with cold. You kind of always want to end with hot. But because the hot will congest the blood, you want to end with the cold to push the blood through and make it circulate again. So those are kind of the two major rules of this kind of hydrotherapy, is you want to end with the cold if you're doing a series of hot and cold, and you want to cover the towels or the sock or whatever you're using, you want to cover it with wool. Okay, so let's go through a basic therapy that you can do. It's called the wet sock therapy. It's also called a cold sock therapy or cold sock treatment. It's been named different things through the years. If you Google this, you're going to find something called the magic sock. The magic sock therapy. So one of our colleagues named it that, and it kind of caught on. So it is magical how well it works. So what you need is just a thin cotton sock, probably about 60% cotton at least. And if you have an infant or toddler, maybe even those little cotton anklets work really well. And then you also want an old ski sock, and you want something big enough to slip on easily over this wet sock. So you would use this therapy for, maybe you have a toddler with an ear infection and they're crying and it's painful, and maybe they have a little fever, or it could be that they're teething, so they have, they're cranky and their gums are swollen. You can also use it for an adult with dental abscess. Maybe there's dental pain. Maybe you've got somebody with really tender sinuses. And this works well as long as there's kind of heat or congestion in the head or face. Or upper respiratory. This works really good for that. So what you're going to do is you're going to take this thin cotton sock and you're going to wring it out of cold water. And when I say wring it out, you get it pretty sloppy, wet like that. And then you're going to wring it tight. So you're going to get all the water out of it. So when you squeeze it, you hardly get any more water. So like that, you don't want it drippy wet, right? So you're gonna wring it like that. And then you're gonna put it on the foot. So I'll just use my hand here for an example. So imagine this is your child's foot, right? You're gonna pull that sock up, and then you're gonna put the dry wool sock over the top. And it's okay if it's big and baggy. as long as you just cover the wet sock underneath, as long as it's covered from the air, that's all you need to do. And you can get smaller wool socks for your kids. I know that sporting goods stores do have wool socks for children, or you can have somebody knit one, which is somebody knitted that one. So you can get them kid size, but you know, if you've got adult size socks, it's fine. Doesn't matter. You can do that for your child too. So put that on both feet, and then you're going to leave that on all night long. And the neat thing is, if you have, maybe you have a 2-year-old who has a really bad ear infection, and they're crying and they're cranky, this will calm them down and they'll probably fall asleep, and then you can get some sleep too. And if there's a little fever, it probably will bring the temperature down a little bit. So it's also a way to manage a fever. You leave these socks on until they're dry. So you don't have to be hovering and checking. You can let that child sleep with these socks on all night long. In the morning, when you take this off, this sock will be 100% dry. So you don't have to re-wet it through the night. You don't have to reapply it. You just put it on once and leave it. So that's the cold sock or wet sock therapy. Go ahead and switch to the next one. This is just a description of what I said. You might be able to see this handout. It's called wet sock treatment, and the indications to use for it. And I can answer questions about that on the question and answer at the end of this if you have any questions about it. But you know, we keep around these old socks, and these are great. They've been around forever. So use that therapy. It's incredibly helpful. And like I said, if you do Google it, you might find magic sock. That's another term that's been tossed around lately in our naturopathic medical genre. And then the next thing I want to talk about is how to do another simple home hydrotherapy if somebody's body temperature is low. So you might not have somebody with a fever. You might have, say you have a teenage daughter with really severe menstrual cramps and she's in a lot of pain. Take her temperature, and probably 99% of the time her body temperature is too low. So instead of like 98.6, it might be like 98, might even be 97.8 or something like that. So her internal temperature is too cold. So what works is to get her blood moving again. This will ease her pain, ease her menstrual cramps, or maybe you have someone with a headache or migraine. It might be the same kind of scenario. So what you'll do then is you'll have somebody sit on the side of the bathtub and fill the tub up with hot water. And they can sit there and put their feet in the hot water, and you want to bring the water up to kind of mid-calf. For not just the ankle, you want to kind of mid-calf with nice hot water. You're going to do that hot foot bath for about 10 minutes. And then what you do is you take a towel, it could be a hand towel like this, and you're going to wring that out of cold water. So you're just going to put this under your faucet and wring it tight, just like I showed you with the socks. You're going to wring it really tight. You don't want it really dripping, but you want it nice and cold. And pretend that this is a person here you're working on. And if this is their body, what you're going to do is put that cold towel right over the belly button, right over their tummy. And then you you cover with wool. You're going to cover that towel up with wool blanket like this. And that's the heating compress. And the person you're working on, they're going to start warming that towel. It's going to feel really comfortable. And it actually brings their body temperature up about 1 degree. So it won't cause a fever. Don't worry about stimulating a fever. It won't do that. It would just come up to normal, and it's going to ease the pain and speed the healing. And so that could be done for someone. Maybe they have a migraine. Maybe they have menstrual cramps. That's usually the scenario I see this in. Maybe there's some gastrointestinal issue, but they have a low body temperature. This is a great little therapy to do, and it's pretty simple. And like I said, if you don't have a wool blanket, you could use a sweater, or you could take a wool scarf and layer it on, but put wool over the top. If they're chilly and want another blanket, put another blanket on top of that, so you can layer them up with blankets. And a lot of times these folks will fall asleep And you don't have to take that towel off in 20 minutes. You could just let them sleep with it on. If you're doing it on yourself and you wake up 3 hours later, throw the towel off and go back to sleep. So there's no magical timing to take that towel off. So that's a wonderful therapy, especially if the body temperature is low. And then I'll give you basics for how to do a basic home constitutional hydrotherapy. And this can be used on anybody, anytime. So whether the temperature's high, whether the temperature's low, you can do it on your children. Maybe they've got measles or chickenpox. Maybe they've got an ear infection. Maybe they've got a cold or flu. You can do this on adults too. You can do this on elderly. So it's safe to use on anyone. So pretend this is like the body of the person. What you'll do is you'll take 2 of these hand towels and you're going to wring them out of hot water. And the hot doesn't have to be super hot. It has to be kind of nice. It makes your skin kind of pink. And if you're worried about putting a hot towel on your child, just feel that towel on the inside of your arm and see if it's too hot. If it's too hot for your inner arm, it's too hot for your little one. So just feel that. But you want it fairly nice and warm when you put it on. And so this is the body, and you're going to put that towel ideally covering from the collarbone to the hips, is what the diagram shows on diagram 1 there. You're going to cover it from the collarbone to the hips with the towel. And ideally with the hot sequence, it's 2 hot towels. So there's 2 hot towels layered like that. And then you can put that Velux blanket or that wool blanket over the top. And another blanket if they want. And you're gonna leave that hot on for 5 minutes. At the end of 5 minutes, you take that off, and then you have 1 cold towel. So here's that contrast. Here's the hot and cold contrast. This is the cold one you wrung out. And don't use ice water. You don't have to make it so cold you can't warm it up. The point of the cold towel is for you to warm it up, okay? So don't make it so cold they can't do that. I've had people put the towels in freezers and things, and you just want to do cold tap waters, plenty cold. And then, so you got the cold towel on, cover that with that wool or Velux, put another blanket over top if you want, and that's 10 minutes. So the sequence here is 5 minutes with hot, 10 minutes with cold, and then you turn the patient over and you do the same thing on the chest and the back. So same sequence, 5 minutes hot, 10 minutes cold, always cover with the blankets, more blankets if you want to make them comfortable, and it's simple. And this is a therapy that will increase white blood cell activity. We know after these therapies, there are 10,000 more white blood cells in circulation than before. It is the fastest way to boost the immune system. It's great if someone starts feeling ill with a cold or flu, go ahead and start the therapies. You can do 1 hydrotherapy a day, and in 2 to 3 therapies or 2 to 3 days, you usually have the infection under control. So hydrotherapy, it seems so simple, but it's incredibly effective. And it's incredibly fast acting. So this is the major therapy that I use here in the clinic. I've used it I've been in practice 30 years, and I treat all sorts of conditions, chronic, severe conditions, pneumonia, people with MRSA, which is a severe staph infection. I've treated many conditions just with hydrotherapy alone, and maybe some of our herbal medicines and homeopathics, and people do really well. So this is the basic therapy you can do at home. It's safe to use on anybody. If you have any questions, I'm happy to answer those for you. But that gives you the basics of why to do hot and cold contrast, and the concept of that heating compress, which is first you do hot, then you put cold to get that flux of the blood through the vital organs or inner core. And then you let that cold towel, cover it with that blanket with wool or Velux, let that body heat warm that up, and then you have that extra action. And that same concept is used with the wet socks, with cold socks. So, okay, so I hope that helped you. And feel free to use that therapy. They're fantastic.
Thank you so much, Dr. Tish. I really enjoyed listening to that. And as somebody who's also been in practice for of 35 years. I also use hydrotherapy a lot with my patients, and I love having something to give to my patients that they can do at home as well. And I also have been a patient of hydrotherapy, and I know its true power and value. And I was sharing via text with my co-hosts around how part of what is so wonderful about hydrotherapy, which I experienced even just listening to you talk about it, is how it's incredibly relaxing. It's a deep kind of relaxation that it's almost nothing else does that. Perhaps maybe some good mindfulness meditation after a good run, but it's very soothing and very calming. I did have one question that I wondered if you would care to answer now, which has to do with, in your mind and your experience over the many years, are there particular contraindications for even these two treatment approaches that you described today? Things that you would think, like, I'm not going to do hydrotherapy with this person because XYZ.
No, we've never found a contraindication to these basic therapies. I would say, though, that if someone has a decreased nerve function, maybe you have someone who's diabetic and has poor nerve sensation in their legs or something, they might not be able to feel how hot a hot foot bath is, or they might not be able to tell you those things. So that's when it's nice if you're applying the therapy, you can tell, like just with your children, put that towel on the inner side of your arm and just know, is that too hot to apply? Is that going to hurt? Because you don't want to hurt anything. But no, they're really, I've never found contraindications to these basic therapies. It's very safe and effective.
Yeah. Good. What about somebody who has like toenail fungus or something like that, or some problems with athlete's foot? Are you concerned at all about the moisture there?
No, because it's temporary, and you're going to be using clean socks, and you'll be washing those socks afterwards. It's that moisture dries out actually within an hour or two. That sock is dry, so it doesn't. I've never seen it exacerbate or make worse toenail fungus or anything like that. Mm-hmm.
That's so good to know. Thank you. I'm sure it's going to reassure people. I'm wondering what your thoughts are on the use of things like hot tubs and saunas.
Well, that's a big topic, and I love hot tubs and saunas. It's a wonderful part of hydrotherapy. I suggest when people do constant heat like that, it is nice to get out and contrast it with cold. So my favorite way to tell patients is if you do a hot tub, only do it for about 15 minutes so you don't get too lightheaded and dizzy. But then ideally get out, go back into your shower. If you got the courage to do this, turn the cold water on and put that cold water on the top of your head and run it up and down your spine. And that gets the stimulation of the nerves, and that's the ideal way to finish a sauna. It's not always what we wanted to do. It's not warm, but it is neat to do that contrast back and forth.
That's really helpful to know.
I posted a short video clip on Instagram this winter of myself in my hot tub, which is sitting behind me here outside my back deck, and then getting out of it and rolling in the snow, which was exhilarating. Very exhilarating. The best part about that is jumping back.
You're a naturopathic doctor when you do that, right?
Thank you so much, Dr. Tish. We really appreciate your thoughts, and we'll come back at the end after Dr. Fuqua. There may be some general questions for both of you.
Great. Okay, great. Take care. We'll see you.
I'd like to introduce Dr. Jean Fuqua, one of my favorite people in the world. There she is. Who is an expert in natural medicine. Dr. Fuqua has been practicing as a licensed naturopathic doctor, both naturopathic medicine and acupuncture, for many years. She sees patients for many different problems, including infertility, mental health challenges, and pain in her general naturopathic practice in Connecticut. And Dr. Fuqua's mission and goals are to empower people to take control of their own health. She practices a beautiful and unique to her blend of both Eastern and Western holistic medicine practice, and really is trying to encourage and support and help people to reach their best health. And Dr. Fuqua today is going to be speaking on some hands-on approaches related to acupressure and a few other things. So without further ado, welcome Dr. Fuqua.
Thank you. Thank you, Dr. Rothenberg, who is also one of my favorite people in this world.
So today I'm going to be talking about acupressure and acupressure for wellness. It's really a perfect time, I think, in the world with things going on to talk about this modality. Okay, in order to talk about acupressure, I feel I have to talk about acupuncture for just 1 second. Acupuncture is a part of a system of medicine, traditional Chinese medicine. And in acupuncture, very thin, hair-thin needles are used and inserted into acupoints, which run along channels that traverse our whole body. And those are used to affect our health and make changes in our health. Acupuncture is known to decrease inflammation. It has a calming effect on our nervous system. It can help relax muscles. It can be pain relieving for muscles and joints. It can regulate hormones. So there's a kind of a wide stretch of how acupuncture can be helpful for our health. And acupressure is derived out of the system of acupuncture. With acupressure, what we're doing is we use anywhere from light pressure, very light pressure, to deep pressure to massage at certain acupoints on the body, and we can use that for pain or anxiety or many things in health. So why use acupressure? One of my favorite reasons to use acupressure is that it allows a way of treating the body that doesn't include needing to take medicine. So similar to hydrotherapy, I feel like it's very valuable and powerful to treat the body without having to take something internally. This ends up being important when sometimes people cannot take too many medications or they have a sensitivity. And so this offers another way to treat the body. The other reason is just it's an easy way to care for yourself or loved ones, something you can learn easily and you can just do this at home. So what can we treat at home? Really, this is a very short list. We can treat a lot. Certainly some things that we need treated require the assistance of a professional, and it's not that it would not be okay to use acupressure. It may fall short of your needs at certain times. However, acupressure is very useful for treating things like anxiety, for strengthening our immune system, for difficulty with sleep, for eye strain, which I think is particularly a problem right now when we're all so attached to computers, and it's kind of how we're doing every part of business and medical appointments and interacting with people. Staring at a screen is not so great on the eyes. Back pain, headaches. So those are the things that I think are really easy to try and use this tool at home. There's many more beyond that as well. All right, so we're going to jump in and I'm going to give you just a few treatment points to use today. I chose points that have value across many different problems that we might want to be treating. So the first area that we're going to be working on is it's around the umbilicus, around the belly button. It's 8 points around the belly button. This area, it's such a wonderful place to treat because it's far-reaching as well. So that tissue where your belly button is, that's where your umbilical cord attached to your mom, and there is immune tissue there. So we can affect the immune system by working around the belly button. And then if you just consider what's in that part of that region of the body, there's so many organs there, right? So we can affect change with any problem with our stomach, or with our intestines. So if you're having an upset stomach or gas or bloating, you can affect change using those points. These points are also helpful for reducing inflammation in the whole body. So you
Hi, Jean. Dr. Fuqua, I'm not sure if you can hear me, but your video image seems to have frozen. So I think, what is the best thing to do? I think the best thing to do would be for you to sign out and sign back in onto the same platform. So if you can try that right now. In the meantime, Bev and I are going to chat a little bit, and hopefully you can sign out and sign back in. Bev, what's your experience yourself with you or your family with acupuncture? Have you guys used it much on your own?
Sure.
Family?
Some of the experiences we've had, they've all been wonderful in various ways. For me, I find acupuncture more powerful, but if we need to do acupressure because it's not possible to get to an acupuncture appointment, then I find that helpful. I specifically found it helpful when I was struggling with a meniscus issue. And a very dear acupuncturist and doctor of Chinese medicine, we connected via FaceTime because I wasn't able to get to him in person for treatment. Yeah. He showed me acupressure points to help. And it was interesting, the acupressure points followed a person's embryological development. Because I remember embryology and how the cells unfold. And I thought it was just fascinating that such an ancient tradition had figured out via energy flows and energy channels and meridians what we would later on learn in Western medicine science, basically how the embryological cells unfold and where the energy flows would be. It's just like, wow, that's just amazing. To me, that's where the healing art of nature and the science of medicine come together. Like some people act like one can't happen at the same time as the other. I'm like, they're talking about the same thing, they just say it differently. And so I think that acupuncture and acupressure are wonderful healing traditions, very effective, at least for myself and my family.
Fantastic. Okay, it looks like we have Dr. Fuqua back. I just want to say that we are in a moment where there's been a lot of storms and a lot of trees and wires down, and many of us in the Northeast are having challenges staying connected digitally. Absolutely. So hopefully we're good to go. And Dr. Fuqua, we just jumped in, talked a little bit about our own experiences with acupuncture and acupressure. So you didn't miss too much.
Glad to have you back.
Okay, Jean, I'm not sure you can hear me, but we cannot hear or see you again, unfortunately.
Yeah, these storms might be messing with this, but that's okay.
My family, interestingly enough, like the things that we've used acupressure for most consistently has been motion sickness. We're a family that loves to get out on the water, get on a boat, and I tend to be quite motion sick. There's some terrific points, on your hand. One of them is right here that we can press and rub. There's another one on the wrist that we can use. And you can look up point, like you can just look these points up actually on the internet. What are the best points on your wrist to use for motion sickness and things like that? We've also used them a lot in my practice. I treat a lot of patients that are in treatment for cancer and having challenges with different kinds of conventional medical care, including nausea, fatigue, pain, and we will use acupressure, and often we'll help train the partner or caregiver on acupressure as another form of loving and healing touch. We know that the human body has a tremendous need and desire for touch in all manner of touch, but particularly in a therapeutic way. So you can marry that to finding actual points that have proven efficacy for bringing circulation to or away from an area, stimulating healing energy moving through that area. So those are other ways that we've used acupressure in our home and in my practice as well.
That reminds me, we had done some pain relief to help my mom when she was so ill and struggling, and I taught it to my kids, her grandkids, and they were able to help grandma in such a practical way. Parents and grandparents obviously put out a lot of love and energy towards children and grandchildren, and it was just wonderful to see them have a way with their young selves to give to her. And you could just see her just open up and relax in a different way. And it's just priceless, right? You can't patent that, but it's genuine.
Absolutely. The other thing that we always enjoy, in our practice, particularly if I'm working with a patient over many years and we have a nice relationship that's developed and they're doing well, but they're in for a visit and the visit's quite short, I then might offer to do a session with them on their feet. There are many of the acupressure meridians that, of course, end in the feet. and doing things. People know this as reflexology, which is it's not exactly acupressure, but it's similar, of course. And we know that most people, except for those who hate having their feet touched, really, really enjoy a gentle approach to working with the feet. Okay,
Yeah.
Looks like Dr. Fuqua.
Okay, I'm so sorry. Yes, we were hit terribly by the storms.
Storm here. Take it
All
away.
right, we'll try again.
Okay. All right. So let me try and quickly run through because I know we lost a lot of time. Sorry about that. I would take two.
No rush. There's no rush, Dr. Fuqua. Don't
Yeah.
feel rush. Do not rush.
Okay. I'm just gonna try and prop up. I don't know if you can see me easily if I'm here.
You're good. You're beautiful
Okay.
and perfect. We can see you perfectly.
Okay, I would use 2 thumbs to hit these points so that you're doing 2 points at a time, and then you're going to be in 4 locations. So I would probably start with like a 3 o'clock and 9 o'clock. And if you see the thumb in that picture, it's pretty close to the belly button, right? And then your thumb spans out from there. So these points, you're going to press on that 3 to 9. And you're going to gauge your pressure on what's comfortable. So if you feel like you can use a lot of pressure there, then feel free to use a lot of pressure. If it's not comfortable, then don't try and use more pressure than you need. Surprisingly, these points can be really effective with light stimulation as well. So I would just hold those 2 points, and I usually count by breaths. So I do 2 breath cycles. So you can take a deep breath in, and then a long, slow exhale out. Another deep breath in, long, slow exhale out. And then you can change to a 12 and 6. Deep breath in. Exhale out. Breath in. Exhale out. The next 2 areas are just on a diagonal. So it would be like a 10 and, what would that be? 5, 2 and 8 maybe, but just on the diagonal, these 2 sides. So pick a side and take a breath in again. And exhale out. Breath in. And exhale out. And last location, you just switch your diagonal, and that'll allow us to have gotten the full way around the belly button. Take a breath in. Exhale. Inhale. And exhale. So I just want people to kind of notice how they feel after having pressed on those points. What usually people experience is kind of a calming or centering feeling. So I think that that's usually easy to become aware of right away. If you're using it for other things like your immune system or for a stomach ache, you might be using it kind of on a immune system on a daily basis. Upset stomach when you have that occurring for you. Another point that is very useful, kind of widespreading, is this point, stomach 36. It is right below the knee. So the bone in the middle of the knee is called the patella, and on either side you can feel right at your knee, there's these 2 little dips, 2 little holes. And so if you're starting at that outer hole, you're putting 1 hand breadth, which is your 4 fingers, not your thumb, but your 4 fingers. So starting at that dip here, you're putting the 4 fingers down, and that's how you're going to locate this point. It's right next to that bone in the shin. It's a really big point. It's a big old hole when you fall into it. It's such a big point that you're probably not going to miss it. And on top of that, we're going to use our thumb for pressure, and our thumb is big enough that you're probably going to have no trouble hitting that point. It's very useful for any stomach condition. It's also a really powerful immune point, and it's probably the most popular within the world for stimulating the immune system. So when you have a cold or the flu, or you're starting to feel run down, like you might be on your way to getting sick, this would be the point that you would want to press on. This point is so powerful that it's used across the world to treat tuberculosis. It is just like an unfailing point, and one that should be in everybody's toolkit. It's easy to find and very, very useful.
Dr. Fuqua, can I interrupt for 1 second and just ask you, because this is such a very important point, can you, and you have on the slide where somebody can find it, a couple of questions. Are you down the very front part of the shin? And then
Yes.
that one hand breath, whose hand? The person doing it on themselves, or the person?
You're asking that.
Yeah, thank you.
So in acupuncture and acupressure, how we measure points on the body is often with parts of our own body. So our hand, that hand breath, and how you measure it's with your hand. So if I am working on somebody, a woman who is roughly the same height as me, then it's likely that our hands are similar and it's going to be the same point. If I was working on a man who is much bigger than me, then my hand breath, it's not going to get me to that point. And so you want to use your hand, which is very convenient when you're doing acupressure on yourself. If you were doing acupressure on a friend or a loved one and they were a different size than you, then you simply measure with their hand. It is directly down. So if you feel in your shin, you can feel that bone. It's just to the side of that bone. And so I just would like for people to try and find that. This way, if you have questions about it later, I can answer in the question section. When you find that point and you slide down, often when you kind of press on it or massage it, it might be a little bit achy. Might feel a little dull, achy sensation. That probably lets you know you found the point and you're in a good place. So this point I think is great with massage. You can certainly just press on it, but I find it very useful to just take your thumb and dig in and massage that point. I think that this should be used daily. I think that anytime, like going into cold and flu season, I think you can say, you know, what am I going to do to keep myself healthy in the cold and flu season? There should be a number of things we're doing, but this is an easy thing you can add into your daily routine for self-care. Next point is kidney 1. It's on the bottom of the foot. This point is really wonderful for difficulty sleeping and anxiety. Those are kind of my top 2 picks of using this point. If you curl your toes under for your foot, there will be a little hole right where you see that red dot, and that's exactly where the point is. This is another point that I think is probably easier to massage it than to just press on it. And since you're massaging it, you're probably not likely to miss this point either. So I think that this is very useful. And same thing, if you want to try and find it, I recommend trying to find it right now. Curl your toes under, and then you just go down underneath that pad of the foot into that hole. It's a little bit tender as well when you do apply deep pressure. That probably lets you know that you found it. And just try massaging that point. So this would be a wonderful point. If you're having difficulty sleeping, I would recommend at night while you're in bed, before you lay down, you simply massage that point. It can become a part of your nighttime routine. There have been times that I've had patients massage that with a little bit of lavender essential oil. You could certainly do a warm compress first and then massage it, but this is very useful. This is also great for anxiety and for headaches, particularly headaches with dizziness. The concept is somewhat similar to what we do in hydrotherapy in terms of a wet sock treatment. We're kind of pulling from the head down to the feet. So with the anxiety and the headache up here, we really want to like kind of pull that away, and we do that by pressing on this point on the foot. The bottom of our foot can take deep pressure, but again, it's your body, and so feel it, and if it doesn't feel great, if you're applying deep pressure, lighten up and do what's comfortable for you. All right, another two favorite points of mine are bladder 2 and Yu-Yao, strange name. But these are on the eyebrow. So bladder 2 is right at the medial end, this inner end of the eyebrow, and Yu-Yao is right in the middle of the eyebrow. So you can effectively, on both sides, touch both points, so all 4 points. These are particularly good for eye strain and tired eyes. That happens when we're on the computer screen all of the time. Good for sinus congestion and sinus headaches. And, you know, we automatically kind of press on that point when we have a headache or when our eyes are bothering us anyway. So we're being somewhat intuitive to know that this is a good area to press, and you probably know you get some relief there. Those are also really beneficial for anxiety. And so I often have people press on these points specifically for anxiety. They can be a little bit sensitive, so gauge your pressure based on how you feel, and know that you don't need deep pressure here. Light pressure is going to be beneficial. You should only use deep pressure there if it feels good, if you're having congestion. But if it's tender, which it often can be a little bit tender, just lighten up your pressure there. And that would be, you know, I'm giving some guidelines about how long you would be pressing or massaging a point. They're just guidelines, and you can certainly do longer for any of them. I would say at least 1 to 3 breath cycles for this. And that is it. I hope that these are useful acupressure points, and that they feel manageable in terms of finding them. You're not going to do wrong by just simply trying to find them and massaging. And the beauty of acupressure is we don't have to be exactly specific on this point. You can be in the ballpark for it. Okay, thank you.
All right, this is wonderful. Thank you, Dr. Fuqua. This was a great, great presentation. I'm wanting to know what your advice would be to people, because I know when people listen to things and sometimes they get eager and excited and then they take it one step perhaps too far. Is it safe for people to do acupuncture at home different than acupressure?
I do not think it's good to do acupuncture at home unless you are a licensed acupuncturist. And, you know, there are, yes, I think that there's all sorts of reasons that you do not want to be needling yourself at home. We want what we call clean needle technique to make sure that you're not introducing any bacteria or something that would cause an infection into your body or into your skin. And there's the possibility of putting a needle in too deep and hitting an organ even. So there's some dangers to using acupuncture on yourself at home. And it's also unnecessary because acupressure is really so beautiful and effective a system. So I practice a Japanese style acupuncture, and one of the things that I learned in that style is you can use very light pressure and affect a great amount of change. And so when I'm telling you, you don't need much pressure, there are times where I've had a practitioner just lightly touch a point and see an immediate change. So we don't have to really like hit something hard. So you don't need a needle at home.
Great. Thank you so much for clarifying that. In case anybody was thinking it, I wanted to be sure they stay safe. Thank you.
Good idea.
You know, both of you have been talking about different things that we use at home. Dr. Tish spoke a lot about using hydrotherapy, particularly with children, and there are a lot of things in the natural medicine toolkit that are more challenging to do with kids. But I think both hydrotherapy and acupressure are things that are really amenable to working with all age children, starting with infants.
Absolutely.
So I'm just wondering if you might want to speak a little bit about your experience, both of you, with working with children and how you see these approaches working well in that setting.
Mm-hmm. So for the same reason, I think that acupressure is beneficial for adults, which is I believe that when we're using acupressure, we just get more in touch with our body. It's a beautiful, simple way to just get more connected in with ourselves, which is important for many reasons, but our health relies in part on us really being comfortable in knowing our body. So for kids, when kids are given acupressure to use, they get to partake in their wellness. And I think that that's very powerful for them to have a say in it and that they can do something to affect change in their body.
Well, I would certainly agree with that. And I think one of the things that's so empowering to parents is they have the ability to help their child. They don't feel, helpless. And, the children actually, after a few of these therapies, they'll actually start asking for it. They'll say, Mommy, I need my treatment. I need my hydrotherapy towels. Or I had a really cute story. One of my patients said she saw her daughter giving her dolly a hydrotherapy. And so when you ingrain that kind of self-care in children from the beginning, it's just incredible. And it's just a really safe and easy way to treat your family. And, I teach grandparents how to do it on their grandchildren. And it's easy to consult with them over the phone and explain how to do a therapy at home. And gee, if that isn't working, call me back. Let me know it's helping. And if not, we can go further. So I just love treating kids and getting them involved in their own self-care. And they know, they're very smart. They figure that out pretty quickly.
Totally. I agree 100%. I have 3 children who are now all about 30, and I have pictures of them sitting 3 in a row with their feet in little pots from the kitchen with hot water in them. I mean, because one of them needed the treatment, the other 2 weren't going to be left out of the treatment. And one of the main philosophical points in naturopathic medicine that we all share, is the idea of stimulating the body's inherent healing capacity. And acupressure and hydrotherapy are 2 ways that we can do that really give us access to those healing capacity.
Absolutely. Yeah.
So thank you both very much for your time and your expertise, and thank everybody for just being in on this 5-part series, which we've so enjoyed, from across the nutrition and exercise and the mind game, and we've just had so many different people on doing what they do best and speaking about areas of medicine that they love and have expertise and experience with. So Dr. Yates, do you have any further comments here?
Yeah, I just would like to thank Dr. Tish and Dr. Jean for your wisdom today and sharing and making this accessible to people who view this webinar, and for us to talk about our children or our parents, our grandparents. This is intergenerational medicine. It's time-honored wisdom, and it's just really great when we find ways to heal that we know leave people in a better place. There's no harm that happens here. It's all good.
Yeah. Well, thank you for the opportunity. It's been a lot of fun. I'm glad we can share the info.
Yeah, thank you. Happy to be here.
Everybody take care, stay well, stay safe, and have a wonderful rest of your day. Bye-bye.
Bye.